Hi, this is Greg Thompson from the Personal Assistance Services Council. I want to welcome you to our call tonight. We're going to be discussing Cal MediConnect, and we have some important information. If you have Medi Cal, Medicare, or a combination of both of them, you need to know that beginning July 1st, the state of California is going to be enrolling you into a managed care health plan. Hopefully some of you have gotten your blue envelopes and you've read those. We have three special guests with us today, and we're just going to jump right into it with Dan Salo from CareMore's, who's the program director for Cal MediConnect. A lot of us have been working on this program for the past 3 years, and I have to be honest, there's been a lot of problems, a lot of issues. People have a lot of concerns. They're worried about health plans. Can you tell me, are the health plans ready in Los Angeles?
Thanks, Greg. First of all, I also want to just thank you for this opportunity and just mention one thing, that in addition to working on Cal MediConnect, I also was a caregiver for 6 years, taking care of my parents. So I kind of understand a lot where people are coming from. There is concern out in the environment, and I think and whenever there's change, there's always going to be concern, and concern is healthy because it just allows people to ask more questions and get better information through forums like this. Are the plans ready in Los Angeles? Yes, I think so, and this is why. I know for a fact for our plan, we have our provider network in place. We've hired additional care coordinators, case managers. We've expanded member services. We've diversified our populations in order to serve the diverse community. And the other thing that is very, very important is that many of the plans here in Los Angeles, they've already been operating in many of the other counties. So they've already gotten their toes wet a little bit and have a lot of experience. So there's even been learnings in the first couple of months that many of the plans have already experienced. So the fact that Los Angeles is going a little bit later has allowed us a little more time to learn from some of the other counties. So in my opinion, I think Los Angeles is ready, and we've been working on this for 3 years now, and I think we're ready to go.
Thanks, Dan. CareMore's is kind enough to have sponsored this educational call tonight. There are actually 5 plans in LA County. Besides CareMore, there's Care First, HealthNet, LA Care, and Molina. And you'll be getting information about that in the blue envelopes. Also, anytime during this call, if you have a question, hit *3. And if you want more information, you can give our screeners your email, and we'll keep you up to date. On the call, we also have Jane Ogle, formerly a deputy director from the California Department of Healthcare Services. Sorry about that, Jane. And she was sort of running point on this until she recently retired and joined Harbidge. Jane, the Affordable Care Act, or what people know as Obamacare, has created a lot of new programs. And California applied for this federal demonstration project we're calling Cal MediConnect. Can you tell us why California applied for this project and why we're trying to put people with Medi Cal and Medicare into managed care or coordinated care?
Sure. Thanks, Greg, and thanks for the opportunity to participate tonight. Sure. The driving reason that we wanted to participate in this demonstration product is because we believe it gives us an opportunity to help people get the right kind of care in the right place in a timely way and have the help and support that they need to manage their care. We believe that people who have both Medi Cal and Medicare are managing by themselves a huge array of doctors and pharmacy drugs and Medi-Cal benefits, and there's no place to turn when they need assistance. And in this way, the plan is responsible. We know who's responsible for helping people manage their care, and we hope that it will allow people to get better coordinated, better organized care.
Jane, and the other thing is, how is this benefiting the state? I mean, the coordination care, the way you described it for the individual, sounds good. But is this also going to benefit the state?
Well, certainly there is a cost saving to the state. The difference between people being in a fee-for-service program and a managed care program always results in a cost savings to the state. And one of the principles that was behind the development of this program at the federal level was that it would be a savings to both the state and the federal government. So there's that. But I think more important than that, it gives us at the state level an opportunity to really know what's happening with our beneficiaries on the Medi-Cal side, something that we wouldn't necessarily have known before when they received services in the fee-for-service environment.
Thanks, Jane. I think we're going to take our first poll question. Those of you that have been on the line before are familiar with this, but those of you that haven't, what we do is we ask a question and give you an opportunity to give us some information. And what I think we'll do is I'm going to practice the first question using Dan, who's sitting next to me. The first question is, I'll ask the question, and then you'll either push 1 or 2 on your phone, Dan. Does that make sense?
Okay.
So the first question is, do you know about Cal MediConnect? If the answer is yes, you'll just push 1. If the answer is no, you'll press 2.
All right, I'm pushing number 1.
All right. Okay, those of you on the call, let's see. Let's try it again. Okay? So the question is, do you know about Cal MediConnect? If yes, press 1. If no, press 2. So again, and it's important to us that you answer these questions so that we can get this information back to the state and to the plans. So the question again is, do you know about Cal MediConnect? Yes, press 1. No, press 2. Great. Thanks for those of you who answered. Now we'd like to get you involved, so we're going to take some live questions. Michelle, can you ask your question for us, please?
Yes. My concern is about dental coverage with any of these managed health care plans. I'm looking for very good coverage. I need to see a specialist, an oral surgeon, and I will need anesthesia. And I'm looking to not have to pay a lot of money, maybe no money, if this plan covers it. And I may need some, like a bridge or something afterwards. So which of these plans can provide that for me?
Michelle, this is Dan. Do you have both Medicare and Medi-Cal today?
Yes, I do.
Well, the good news is, you may not know, but Medi-Cal has begun providing Denti-Cal as of May. And so Denti-Cal has now been made available again to those with Medi-Cal, and those with Cal MediConnect plans will be able to make Denti-Cal available to you through the plan as well. So if you join Cal MediConnect plan, you will still be able to get the Denti-Cal coverage. Some of the plans have the option of providing some expanded coverage as well, and you'll have to look at those individual plans. But again, Denti-Cal is back in California.
I realized that, and I looked, and there's only about 6 dentists that qualify in my area, and they don't have high ratings. I actually called one of the managed care plans, got a whole list of dentists, and most of them didn't get good ratings when you went to research it. So that's my concern, and I would need a specialist for my particular instance at this point in time.
You know, that's a good point, Michelle. Jane, can you tell us a little bit about how the state is managing the health plans to make sure that the care they provide will be sufficient?
Sure. So particularly, just going back to the Denti-Cal part of it, in most of the counties except Sacramento, Denti-Cal is a fee-for-service benefit and will not be a plan benefit through Cal MediConnect. As Dan said, some of the plans are offering additional dental services over and above the fee-for-service benefit. So it's important to work with Denti-Cal and find a provider that you think is appropriate for you, but that's outside of Cal MediConnect. As far as Cal MediConnect goes, both the state and federal government did a very extensive review of the networks and the number of providers that each plan had contracted with in Cal MediConnect, so that we were comfortable that access would be available to people for all of the various specialties and ancillary services that a person might need for their health care.
And Jane, when you mentioned fee-for-service, could you explain fee-for-service, what that means and how that
Sure. So both in Medicare and Medi-Cal, when a person is enrolled in either of those programs, they are put into what's called regular Medicare or regular Medi-Cal, and that's the fee-for-service system. In most counties today in California, on the Medi-Cal side, a person must choose a health plan after they've enrolled in Medi-Cal, but that comes a couple of months later. In Medicare, a person always has the option to remain in regular Medicare, fee-for-service Medicare, and not have to choose a health plan.
Thanks, Jane. And again, at any time, if you have questions or if you would like more information about the specifics of enrollment, you can press *3. Also, you can call the HICAP in Los Angeles, and their phone number is 800-434-0022, and they can answer specific enrollment questions. Again, 800-434-0022. Alicia, can you ask us your question, please?
Yes, I wanted to know if I could get my own plan, or are you just automatically going to put me in a plan?
You know, that's a great question. Jane, do you want to explain?
Sure. So people will have choices. The state, when you get your blue envelope, will have looked at your Medicare doctors and picked a plan that contracts with your Medicare doctors for you. But you don't have to choose that plan. You can choose to join a different Medicare plan in Los Angeles, and as Greg said, there are 5 of them available. Or you can choose to stay in fee-for-service Medicare. You do have to pick a plan for your Medi-Cal benefits, and your Medi-Cal benefits would be your long-term care benefits, in-home support services, if you go to an adult day health care center. And then the plan is also responsible for any deductibles that Medicare requires. But you must pick a Medi-Cal plan. You have a choice of joining a Medicare plan or remaining in regular Medicare.
Thanks, Jane. Geneva, do you have a question for us, please?
Well, I have a question, but she just answered it. I'm calling for my mother. She's 95, and she has regular Medicare, and she also has her retirement medical insurance. The only reason she has Medicare is because of the in-home supportive services. And my question is, can she keep her regular Medicare? And she just answered it.
Right.
Great.
And actually, since she has retirement insurance, she would not be qualified for Cal MediConnect because it's only for people who have just Medicare and Medi-Cal and not other insurance coverage.
Oh, I see. All right. Thank you.
Okay.
Hattie, are you there?
Yes, I am.
Oh, good. We're ready for your question.
Oh, I was just wanting to know about the eyeglasses. Can we get when we go to the eye doctor? Can we get our eyes checked and then Medicare pay for it? Right now, they're not paying for it. And I just bought some glasses.
All right.
So there's a vision benefit in Medi-Cal that would cover your eyeglasses, and some of the plans are supplementing that benefit with more frequent eye exams and with different frames and from different providers. It would be good to just check with the plan that you pick to join about what their supplemental vision benefit is.
Yeah, I got Care First, and they said they're not paying for it. I have to pay for my glasses.
Okay, there's a Medi-Cal benefit for glasses, but it's every 2 years.
Oh, yeah, I think that's what they were saying. So, okay.
Right.
All right.
Yeah, Hattie, the Cal MediConnect plans are required to cover whatever is covered under Medi Cal. So the vision benefit is available through the Cal MediConnect plans. As Jane said, at a minimum, they have to provide glasses, an allowance for glasses every 2 years.
Thanks, Dan. We also have with us tonight Dr. Bakshan Day from CareMore's. He's a hospitalist. Welcome to the call, Doctor. I'm going to call you Dr. B because I know that's what they call you in the clinic.
No problem.
Obviously, one of the key players in anyone's healthcare is the physician. Can you tell us about the role that a physician plays in managed care?
Just like in fee-for-service, the relationship between the patient and any doctor, especially the primary care doctor, is critical in managing the health and well-being of the patient. Not everyone has an established primary care physician. They may see multiple doctors. The last study that I read, actually with patients in the Medicare fee-for-service world over 65, are seeing up to 12, 16 different doctors. And what a managed care or care coordination does, and what we do, is essentially bring that all and bring you into a part of a team. We're offering you the possibility to be the leader of the team, and in your team, you have your primary care physician, you have your specialist, you have a social worker if necessary, and you have a case manager who is really like your navigator. And that person will help you, and you get to choose that person, to help you navigate through the system. It's very different from, I think, the fee-for-service world that we have today. And the idea is really to maintain health and improve your quality of life. And this has been proven successful, and helps people manage their health and remain in their homes and living independently as much as possible.
And again, the term fee-for-service basically means you keep your Medicare yourself. A lot of us are concerned about, we get used to our physician, and if we transfer to a health plan, are we going to be assigned to a primary doctor? Is it going to be difficult to get appointments? How do we know that we're not going to have to wait a long time for care?
Well, so there's a couple questions there, but I think I'll answer the first one, which is will it be difficult to get appointments? And the answer now with managed care is actually no. We are from the Centers for Medicare Services. We are audited, and it is a big part of the requirements for individual physicians that are working within a managed care program to provide service as soon as possible. And we are penalized from Medicare if we don't do that in the Medicare world. Outside of that, in the fee-for-service world, there's actually really nobody looking at, can you see your doctor within a day or a week or 2 weeks? I talk about my grandmother all the time, who's 92, and she has Medicare and Medicaid. And to see her doctor at earliest, it's typically about 7 days before we can really try and stress to see her doctor. Outside of that, the coordinated care is really based strongly upon the relationship between the primary care physician and the patient. And what we want to do is we don't want to disrupt that from a physician standpoint and from the standpoint of the health plan. We don't want to minimize disruptions, and we don't want you to lose your primary care physician or the physicians that you have now. And what we will do is try our best to contract with them, and if they are okay with the rates that the health plan is going to pay, then we'll continue to do business with them, and they can continue to serve you.
Thanks. I appreciate your answer, but I'm still not 100% convinced because, I know a little bit about, fee-for-service versus, health plans it's my understanding, health plans are going to be given a single rate per member per month. And, how do we know that you're not going to ration care in order to make money? Dan, seriously, how's managed care going to handle that?
Greg, I'm really glad you asked that question, because that's a common fear of a lot of folks. And it's kind of old school thinking. That's the myths of managed care from back in the 1980s and 1990s. What we're really talking about is a system of care where we want to see you more often. We want to see you early and often. CareMore, in fact, was organized and founded by a group of doctors who believed that if they spent more money and time up front in providing preventative health and being able to catch things early, that they could actually save money and there'd be enough left over at the end for everyone. And so this is, old school healthcare is really more like sick care. You wait around until you get sick because your symptoms are so bad that you have to go see your doctor, or worse yet, end up in the emergency room or possibly the hospital. That care is very, very expensive. What we've learned over time is that if you come in early and often, we can catch things sooner. I was talking to one of our members just on Friday who was actually being evaluated for some breast cancer. And in that process, they actually found out that she needed a pacemaker. So they were able to take her in and take care of her heart condition and because that was kind of unknown to her, and be able to take care of the heart condition. And also she's now beginning her breast cancer therapy. And she was tickled as pink by the fact that they caught this now she has a much more extended life. So it's about catching things early before things get so bad that there's really little that we can do. And at that point, it gets very, very expensive.
I appreciate your answer, and I've heard the commercials about, all the preventive things that managed care does and how a hug can keep you healthy. But, I'm really concerned, and a lot of people are really worried about when it comes to needing a specialist. So I'm going to ask this question to Dr. B. Aren't you motivated to keep people from seeing specialists because they're so much more expensive?
No. The short of it is no, because you're really the driver of the healthcare should be the patient. And that's what this is all about, and that's what I think Cal MediConnect is all about. And from our perspective and from managed care is, yes, there is a driver of cost there, but if it's necessary and the patient or the primary physician and think that it's necessary to seek the expertise of a specialist, then we want you to go to that specialist and we want you to see them. Because what will happen is, if the health plans decide, no, we're not going to let you do that, you're going to end up getting sicker and you're going to end up in the emergency room and in the hospital. And as a physician, that's the last thing I want to see. And I think as a health plan, we would agree as well.
Jane, if I'm unhappy, so I'm hearing what they're saying, but if I'm not getting the services that I think I deserve from the health plan, what is the state doing? What are my options if I feel like I'm not getting the service that I expected?
Sure. So there are many options available to somebody if they're not getting the services that they expect. First, they can file a grievance with the plan. That's, probably the first line of just saying to the plan, I'm dissatisfied. The next option is they can contact the Cal MediConnect ombudsman and file a grievance there with the quality or type of service that they're receiving. The third option is that they can call the Office of the Patient Advocate here at the state and file a complaint there. A final option is that they can withdraw from the Cal MediConnect plan and just choose not to participate, and that participation would end at the end of the month in which they choose to withdraw. But we at the state and the federal government are going to be very focused on what kinds of complaints we receive about plans and how those complaints are resolved. That's a major issue that the state and federal government overseeing these plans is focused on.
Thank you, Jane. We're going to go to our second poll question. I also wanted to remind you that at any time you can hit *3. I know that we're throwing a lot of information at you. So hit *3. You can talk to one of our screeners. You can ask a live question, or you can give us your email address and we'll keep you updated because there's a lot going on. All right, so we're going to try our second poll question again. Remember, I'm going to ask the question, and all you have to do is hit number 1 or number 2 on your telephone. So our second question is, if you have Medi-Cal, press 1. If you have Medicare, press 2. And if you have Medicare and Medi-Cal, press 3. Once again, if you have Medi-Cal, press 1. Medicare, press 2. Medi-Cal and Medicare, press 3. So I'm going to give you a chance to do that. And again, we appreciate it. We have over 4,000 people on the call. So we're very excited about that. And we thank you for being on the call. All right. So now we're going to take some more questions. We really want to hear what your questions are. Barbara, go ahead and ask us your question, please.
I almost don't know where to begin. I am running into some problems with participating in Cal MediConnect, and that is finding out that I couldn't actually see one doctor because he's reached his limit. So the plan told me I had to wait till the first of the next month, which was close to 30 days, before I could see someone else. So those are circumstances under which you do have to wait. The other thing is my recent experience with a dental office that's under the plan with LA Care. I don't know. They must think we're just walking through the door ready to be picked. I picked that insurance because there was additional coverage for dental, and yet before I left, they told me I owed close to $3,500 if I wanted them to do the plan for me. And I had a competitive price on the dental work that I needed without insurance, and that was only $1,700. So can you see what some of us may be running into, and definitely what I just ran into recently.
That's an awful lot. Jane, do you want to start and tell us again how it's supposed to happen?
I will. So it is supposed to happen that, if a physician panel is closed, you are supposed to be assigned to another physician right away so that you can receive the care that you need. And if a physician panel is just not accepting new patients, that's something beyond the control of the plan, but they do have to get you to a physician. I'm a little surprised about that. I'm a little surprised about the dental services. LA Care itself doesn't offer dental services. It offers some supplemental services. And I'm a little surprised about any dentist telling you as a dual eligible Medi-Cal recipient that you have a cost for your care. Unless you have a share of cost in Medi-Cal, you should not be being charged for your care. And
Liberty Dental works with LA Care in conjunction. How that is put together, of course, I don't know. But if you need dental care, you have to go through their provider, which is Liberty.
Okay.
And then I had a choice of dentists, and I chose one, and they had a beautiful office. Now I know.
So I guess then, Jane, her first call is to LA Care, and then if that's not resolved, can you tell us who's she calling next?
Yes, her first call is definitely to LA Care. And if they are not able to resolve that, I think that she should call the Cal MediConnect Ombudsman. And that number, just give me a second here and I'll get it because I just don't have it off the top of my head.
I do, Jane. I can give it to you. It's 855-501-3077. And again, that's the Ombudsman number, 855-501-3077. Patricia, do you have a question for us?
Is that me, Patricia Romero?
That's you.
That's me. Yes, I have several. I'm not familiar with what Obamacare is, and this one you mentioned called Cal MediConnect. Is that a plan, a new plan? I've never heard of it. And you said that people on Medi will be, the Medicare part, you'll be placed in a new plan. Now, I was in Medicare. I was placed in a plan. Then I was taken out of a plan, and they put me back on straight Medicare. So now I'm just hearing for the first time. I just got on straight Medicare, and I have Medi Cal and Medicare now because I just turned 65. So I'm just getting used to this, and now I just find out next month we're going to be put in another plan, and I'm wondering what are the plans because I was in HealthNet and have been in Care First, and I was very disgusted with both of them. They authorized my knee surgery, but then when the bill came, they wouldn't pay a penny of it. So I couldn't understand. They turned me on to a great doctor, authorized it, and I couldn't get them to pay 1 cent. And my primary doctor warned me, I bet they don't pay. So I had to call an advocate center for healthcare rights, and they put me on straight Medi. So I just started on Medi, and I haven't really got, going on it. So I'm so shocked to hear I'm not going to be, I'm not going to even get to see how this works because I'm going to be placed in another plan, and I sure hope there's a more variety than just the two plans that were offered to us before.
There's actually 5 plans in Los Angeles, but first you'll get a blue envelope if you're going to be, before you're even placed in a plan, or you can always choose one of the 5 plans, CareMore, Care First, HealthNet, Molina, and LA Care.
When you say CareMore, I thought when I heard this is sponsored by CareMore, this is so mind-blowing because my father, who I take care of, he's got dementia, and my mother passed away, and they've been on CareMore for years, and they just sent me a letter saying, we have to drop your father. And at this point, when he's stage 4 dementia, I had 30 days, and I was ill, and I didn't know what to do or who to turn to find a plan, the right one for my dad. And I got in a plan that is so bad called Brand New Day, and they told me they specialized in dementia. And they haven't even got my dad a doctor, so I don't know what to do. But regarding my dad, who has Medicare, and he's with this plan, as soon as they get out, could I get my dad back in CareMore?
Why not? We'll let Dr. B take that question.
I think one of the things that, I would ask you to do is to call the member services line at CareMore and discuss that with them. It sounds, based on what I can see, that it may be from a service reduction. To be part of Cal MediConnect and just plans in general, but I can speak for CareMore, is that we only have specific service areas. So if your father lives in a zip code that is not within our service area.
That's what he was in. My parents lived in Montebello, and that's where the offices are. And I called him and asked him, could I move my dad closer to me, because I live in the San Fernando Valley, and I need him, to check on him. I need him to be living near me. And so they told me to join CareMore's Touch, and that would give a wider variety of zip codes. But now they have taken away the zip codes in the valley. So I was hoping and praying that they will restore a few of the zip codes here in the valley. If not, I like CareMore, and I would love to be with CareMore. And they also, sent a nurse practitioner to the convalescent home for my father every week, and that's worth gold to us.
Can you do two things? If you have a pencil, I'm going to give you CareMore's number again. You can call them call them directly. 888-350-3447. And you can also hit *3 again and leave your information with the screener, and we'll make sure it gets to CareMore. Jose had a question for us. And his question was, does he have to choose a plan? And Jane, do you want to, explain how that works, Medicare and Medi-Cal one more time, please?
Sure. So when people get the guidebook and the choice form, they have to choose a Medi-Cal plan. And if they're Medi-Medis, the Medi-Cal plan will cover their in-home support services, their community-based adult services, their nursing facility care, and then any of the deductibles or other co-insurance that Medicare has. So the plan would be responsible for those pieces. They must make a choice of a Medi-Cal plan. They have the option to choose a Cal MediConnect plan for their Medicare services. A person can choose to remain in fee-for-service Medicare, regular Medicare, or they can choose to join one of the plans. I want to also mention that in some zip codes, people also have the opportunity to choose a PACE program, which is a comprehensive health and social program for people who are over 55 and at risk for nursing home placement.
Thank you. I want to give out one other number, and it's healthcare options, and they can help you in making these choices. 844-580-7272. 844-580-7272. Cindy, do you have a question for us?
IHSS question?
Yes, please.
Okay. Right now we have independent provider mode. I can pick my own provider to take care of me. But I know it's supposed to stay the same for at least 1 year, but I'm worried about down the line. Is that going to change? Because I don't want somebody else picking somebody who's going to work for me in my own home.
Greg, can I try to answer that?
Absolutely.
So one of the basic commitments that was made in the legislation and throughout all of the conversations that we had about IHSS and its coordination with the medical plans is that a person will continue to have the right to pick their own providers, to hire, fire, manage, and supervise their providers. And I think that is so integral to the development of Cal MediConnect that I don't envision that's going to change anytime in the future. That right is something that's very important to people who receive in-home support services, and I believe that the state respects that right very strongly.
And I appreciate that question, Cindy, and I'm going to throw this to Dan. Living with a disability and understanding the self-direction is very important to me too. But again, if the health plans eventually at some point have all the financial responsibility, including IHSS, how do we know that you're not going to drop the self-directed care or the independent provider mode and go to an agency and send us people from home health?
Great question. And again, this is one of those concerns that many people have. The fact of the matter is part of the core foundation of Cal MediConnect is the ability to identify services that are available in order to bring them into the home so that people are able to continue to live with dignity and thrive within the home amongst friends and family, as opposed to being placed within facilities. So it's really about educating the whole healthcare professionals to have greater awareness and understanding of the various programs and services that are available through like IHSS or the CBAS programs, and be able to bring in and identify needs and bring in services that allow people to remain in their homes and to thrive. The other thing, as we mentioned earlier in the call, fact of the matter is it's very, very expensive to provide care in facilities. We want to be able to allow people to stay in the home because, one, they do better in their own home environment, and it's actually less expensive. So it's a win-win for everyone, really.
Do we have any more questions from the audience? Kathy, would you like to ask your question, please?
My question is I believe it's two, but we'll see. One, you have Cal MediConnect. Under that umbrella, you have HealthNet and HealthNet, Cal MediConnect, and in Molina do. What's the difference between Cal MediConnect and Medcal Health? That's number one question.
Basically, go ahead.
Cal MediConnect is the name of the program that Molina and HealthNet are both participating in cooperation with the state and the federal government. They both offer exactly the same benefits. The plans do. The difference between the plans would be in their network of providers and possibly in some of the different types of drugs they have on their formularies. Within each of they have to have drugs in all of the classes, but they might have a different brand or generic in their formulary. Those are the primary differences.
Okay, if you're saying that if a patient cannot take generic, they need the actual brand name, will you be able to provide that?
The plans all have a formulary, and they all have a requirement to make sure that a person is receiving appropriate drugs. So there are ways that a person can appeal and say, I don't want to take a generic drug, particularly if the doctor writes just a brand name, no substitutions. The plans generally have to honor that.
But isn't pharmacies an area where they can change and do whatever they want?
Anytime a change like that, any kind of change that would make you concerned when you're in a Part D plan, or any Cal MediConnect plan, you have the right to appeal that decision and to request that change not be made.
You know, we were using the word formulary. Doctor, can you tell us what a formulary is and maybe elaborate on her question?
Sure. So a formulary is a fancy term that we use for your medication list and what medications are covered by a health plan. So to answer a little bit of your question, yes, it does depend on the health plan and what medication you're taking. Some companies like Pfizer and Merck, they're the big drug companies that make specific drugs or medications that we take. Some health plans have better contracts with them, and they may have better rates. So it is important for you to see if there are certain medications that you can't have generic, if one of the 5 plans will cover it. I can tell you from CareMore's perspective, we've looked at a lot of medications that are covered by Medicaid that are brand name, and we've added many to the formulary, and I believe the other 4 have done the same.
It kind of leads me into a question I have for you. I know that all the health plans are going to have to do a health risk assessment with their members. Could you take us through that process?
No problem. The health risk assessment, we've been doing it in CareMore for almost 15 years now, and we find it very important. And I'm excited as a physician that the other health plans and those participating are also going to be required to do this. And what a health risk assessment is it's there to decrease disruptions in many things. First, in your drug refills. We want to know what medications you're taking so that this doesn't become an issue when you go to your pharmacy to get a medication and they tell you that it's denied. When we're able to sit down with you and talk to you about your health and within the health risk assessment, we'll be able to identify those things. Now, what exactly is the health risk assessment, or you may hear the acronym HRA? It's essentially a set of questions that look at your health both now and previously, what medications you're taking, maybe some of the diagnoses that you've been given along the way, whether or not you're getting any IHSS or long-term support service. And that gives us an idea about you, and also we don't want to disrupt your care, so it tells your new insurer and your new plan who to make sure that they're continuously contracting with. Now, this can be done a couple of ways. It may be done over the phone. It may be done as a questionnaire that's sent to you at home and you send it back to the health plan. What we like to do at CareMore is we like to bring you in for a head-to-toe exam and ask you all of the questions. And the reason for that is that we found that by doing so, not only are you getting a checkup that not all of us get on a yearly basis, but we see head-to-toe what's going on. We may identify things during that exam that, maybe you did need a pacemaker like someone, Dan had mentioned earlier. Maybe there's something on your skin that we need to send you to a dermatologist. Maybe we identify that you need an in-home support service, and we can help you with that referral. And so with your permission, we would then go forward and do that. And we also invite your caregiver or IHSS worker to come with you for that, so that we make it all part of a team and we become one team. Because ultimately, I feel that it's the team these days that really helps us drive and navigate the healthcare system.
A lot of us really pride ourselves on our independence, and we've been hearing about these coordinated care teams. And what if we don't want a team? What if we don't want people telling us when to come in for appointments and who's going to be on our team? Dan, you and I talked a little bit about this. Can you describe how this works?
Well, again, it's a great question because one size does not fit all. And a lot of folks actually have spent most of their lives organizing their whole healthcare system. But some people may need different levels of help. In fact, I think there was a quote in a AARP research that made this statement that some people want more help than others, and others want more care than others, and your needs change over time. So if you're someone who doesn't particularly need a lot of help, you've got a whole system mapped out, you may not need the help of a case manager, and that's perfectly free up to you. The nice thing to know about something like Cal MediConnect within a coordinated care plan is that if your needs change, you can always have access to a case manager. For example, the lady I spoke to you about who had the pacemaker and the breast cancer, I asked her if she had a case manager, and she said no. They asked me if I wanted one, but I have a lot of family taking care of me, and I didn't think I needed one. But it's nice to know with any type of insurance that if you ever needed something, if needs change, that you have that option available to you. We really haven't talked about the role of the case manager, but I'll tell you, having helped take care of my mom before she passed away, and she was in fee-for-service, and I have a lot of experience in healthcare. That last 2 years in trying to provide care, trying to find the right care setting, trying to get her into the right doctors, and figure it out all by myself was a challenge. And I know Arda, in taking care of his grandmother, has had similar challenges. And most people don't have people with that experience or that local wisdom of what's available in order to make good choices. So working with a Cal MediConnect plan that uses a team approach with your doctors, specialists, care managers, nutritionists, social services, all working together to give you enough information to make the right choices for yourself is a very, very valuable experience, and you just don't get that with fee-for-service. You may get people that handle different parts of it, but they may not see the holistic needs.
Thanks, Dan. I wanted to remind you, if you want additional information or if you want any of this in writing, you can hit *3 and ask our screeners or leave us your email, and we'll make sure you get it. You can also, if you have internet, you can go to cowlduals.org. They have a lot of information there as well. I want to ask our poll question, our last one, if I could. Again, all you have to do is press a number on your phone. The question is, was this call helpful for you? Yes, press 1. No, press 2. I'm going to repeat that. Was this call helpful for you? Yes, press 1. No, press 2. So I think we have a few more minutes to take some questions from people on the phone. While we're looking through our thing, I just wanted to kind of, what Dan was talking about, make it clear that what I heard was that these services are available to you, but you have the choice if you want a case manager, and you have a choice who is on your care coordination team.
I think it's important to know that we don't want to force you to do anything. We just want to help, and we want to be there to help when something happens. If I may give you a quick story about my grandmother, again, since the last time we spoke, she fell at home a couple weeks ago and she broke her spine. My mother called her primary care doctor, who couldn't see her, and said, go to the emergency room. So she went to the emergency room. They told her she had broken her spine and that she should go home and stay in bed. And I asked my mother, well, did you call anybody? And she said to me, well, on my Medical card, there's no phone number. And on my Medicare card, there's no phone number. So I don't know who to call except for her primary doctor. And so, what happened was I called my case manager at CareMore, and my grandmother is not a CareMore patient. And she was able to help me get what was needed for my grandmother, where 3 days later she's walking into her, not in bed, and walking to her adult daycare facility, which she loves more than anything in the world. I think sometimes more than me. And it was because of the coordinated care and having the case manager when we needed it. My grandmother lives out of a service area for managed care, but we're looking to find something where she can have a case manager, because I don't want her to wait until something bad happens and she ends up in the hospital. I like knowing that my mom will have an option to call somebody and they can help you. And on all of the Cal MediConnect cards for all the plans, there's a phone number that you can call to speak to somebody to help direct you through the healthcare system.
I have a question that we got a call today. Jane, I'm going to ask you the question. This will be the last question. Earlier we talked about if you decide to stay with your Medicare, but you have to choose a Medi-Cal plan. The question we got today is, if you go to your Medicare doctor and the Medicare doctor doesn't want to bill Medi-Cal, that doctor, can he actually bill you for the Medi-Cal portion, and then it's up to you to try to collect that from the Medi-Cal plan?
Greg, thanks. That's an excellent question. We've been hearing a lot of this, and I'm very concerned about it. both state and federal law prohibit doctors or anyone else from billing people who are eligible for Medi-Cal services. So people who are fully eligible for Medicare and Medi-Cal should not be billed for any service that they receive, and they are not liable to pay that bill if they get one. I have heard people talk about being billed for the 20% on the Medicare side of a doctor's visit, and they just don't, it's not their financial responsibility. State and federal law are very clear that that is not permissible and it is not their responsibility.
Thank
Does
you.
that answer you?
Yes, thank you for clarifying that. That will help us as we get those calls.
Great.
And I want to thank you, Jane, for being on the call with us. We appreciate it. Dan, Dr. Bakshande, and CareMore for sponsoring this call, and we hope it was helpful. Thank you all again, and I'd like to thank the staff here at PASC and that have worked hard to put this call together. All right. Good night, everybody.